Welcome to another episode of Aesthetic Revolution, the podcast, where we talk about things aesthetic and medical from forehead to feet with a concentration on what's in between. I'm Dr. Ed Zimmerman, aka the Dick Doc, and this is Stacy Taylor Zimmerman, my better two-thirds, director of aesthetics, and the one who takes a lot of the calls, keeps me from going down rabbit holes and talking too much about little bits of trivia. We'll try to have a broad discussion. And today we're going to talk about one of our favorite topics. It's called the HapPenis Procedure because it creates happiness for both men and their partners. And it's all about getting girth on the shaft of the penis. So,
no further ado.
Without further ado, guys have issues. You know, in the almost 40 years that I've been practicing medicine, we are at Aesthetic Revolution a 5,300 square foot of space of fun with a fully accredited, nationally accredited operating room. And yet the thing that gets the most attention, aside from facelifts, high-def liposculpting, toxins, fillers, every wavelength of laser and light. But what gets all the attention?
Happiness.
Happiness.
Pickles.
Pickles. Godzilla.
Eggplants.
Yeah, all that stuff.
Richards.
So, okay, we give up. We're going to talk about it. This is a procedure that has a long history. When I was one of the first 25 docs in the United States to go to train with Alfredo Hoyos in Colombia. And part of what we learned from Alfredo was that what you leave is as important as what you take away. And sometimes you got to add more. So when you remove fat, it's a living graft.
So you learned high-def lipo from him.
And we started our journey of learning how to handle fat as a living graft. So when you rip fat out from its blood supply, its nutrients, its waste removal system, it doesn't just live. A portion of it dies. And it can be unpredictable. And over the past 20 years, we've come a long way in helping understand how to get longer lasting fat grafts. So when we would do high-def lipo, one of the things that we would do sometimes is supplement the girth of the penis because we had extra fat available to do that. And we had variable results, sometimes great, sometimes not as good. Sometimes asymmetry was produced when one area inflated and the other area kind of died off. There were lots of variables there that we've worked hard to master over the years, and we've done a pretty good job that it's a better procedure now. But not everybody has fat. Not everybody wants to have a procedure to isolate fat. And, you know, again, some guys just don't have enough fat to be able to move. So we had to come up with another way to
Some people
supplement
metabolize
girth.
it as well. So any fat that's moved and grafted somewhere also is going to be metabolized first. So if you're working out a lot, and a lot of times people who come in for high-def lipo, fat grafting to somewhere else are people who are active and are working out a lot. And so they just aren't good candidates for this grafting because they are going to metabolize it really fast.
The body's going to see that as an available source of calories and it's gone. It's eaten. So whether we're putting the fat in the face, the male or female chest, the tush, the Brazilian butt, the BBL, or the male equivalent of the BBL, the HapPenis procedure, fat isn't always the answer. So we had to come up with other possibilities. And over the past couple of decades, what we've come up with is using FDA-approved fillers, and we'll talk about each of the categories of fillers that are FDA-approved in the face, for injection in the face and sometimes the back of the hands, to other areas.
Guys call in every day. The number one question we get is, can you make my penis longer and bigger? Everyone. Every guy wants to know. And we tell them, yes, we can. We can give them more girth and we can give them the appearance of more length at rest.
Notice, appearance of length at rest. We're not stretching your arm longer. We're not making your leg to make you taller, at least not in a long-term fashion. But we can engorge or inflate the shaft of a penis so that a retractile penis or a accordion penis appears to be more full most of the time. So even a grower turns into a shower, but a shower doesn't get any bigger with erection than it normally would, but we can add girth.
But what I will say is that a lot of people whether they're doing an implant or they're being told by another provider that can add filler, that they will get more length. And they are being told this all the time. And so one of the things I'd love to touch on is the fact that is not, that they're misleading. And
it probably isn't the truth. Now, statistically, and let's talk about implants briefly. It's not the point of this podcast,
right.
But an implant either goes in where the hydraulics are. So the corpora cavernosa are the hydraulics that inflate with blood to maintain an erection at 10 o'clock and 2 o'clock across the top, and the corpora spongiosum across the bottom. And that contains the urethra and goes all the way up to the tip of the penis, which is actually part of that vascular space. And one of the reasons we don't inject it very much is because we don't want to get a vascular occlusion in the tip. But I digress. If you put a flexible implant or an inflatable implant into the hydraulics, that hydraulic function is essentially gone. So you're dependent upon the implant to do that. Now, there are other implants that are either sleeves or wraps around the shaft of the hydraulics under the skin. And if they push against the pubic bone and they push all the way out towards the corona of the glands, the base of the acorn, if you will, there may be some improvement in length that can be long lasting, but it's not a guarantee. It doesn't happen in everybody. And there are pros and cons to those procedures as well. Girth, on the other hand, is something you can do pretty reliably without having a surgical procedure and without obliterating that man's innate ability to have an erection through the corpora cavernosa and spongiosum.
So there's a huge risk you take when you do use an implant versus using a filler. But some people are a good candidate for an implant, but
better candidate.
A lot of men that are looking for fullness and the appearance of more length are really just looking for that. And the filler is going to be the best option without any adverse events. So there's a place for both.
There's a place for both, sure.
Right. But they are not going to get an extra 5 inches in their length, which is what they really think. And a lot of companies will tell them that's what they're going to get, even though they know they're not going to. Not even 2 inches. And that's what but that'll be a topic for another podcast when we talk about lengthening the penis and the pros and cons of lysing the dorsal penile ligament and things like that. I'll just go to the end message there. Don't do that. But anyway, let's talk about girth. Why is girth important? Well, I know why girth is important, but
from a girl's point of view, why is girth important?
Well, because most of the sensation that a woman feels is in that first inch or 2 of the vagina.
So if you're traveling to Virginia or the birth canal, there's more nerves per cubic centimeter in that initial 1 or 2 inches. So if you can have more girth to put more pressure and to provide more sensation in the introitus, the beginnings of the vagina, as well as the clitoris, and to satisfy the G-spot, your partner's going to have a happier time. So might as well put your money where your mouth is, as they say. So length is not as important to most people. Again, depending on anatomy, depending on position, that's a whole nother podcast. And so guys come in asking for girth. And typically, if they are an exercise enthusiast, or they smoke, or there's even a hint of diabetes, or they're on certain medications, all reasons that fat would not be a good candidate for them, we talk about fillers. And there's 3 basic categories of fillers that we talk about. So in no particular order, and if I go down a rabbit hole, stop me.
I will.
But hyaluronic acids, or we call them hyaluronic gels because guys are afraid of acids, but there just happens to be the pH involved. Hyaluronic gels are a substance that lives between the cells of all living things. There are dozens of companies in the world that make hyaluronic gels, and we've been putting them in the human body for over 2 decades. They are, in general, soft, pliable, lovely, marshmallowy, movable little bits of volume that we use primarily in lips and under eyes, places that move a lot. They don't necessarily give us as much lift to chisel a jaw or to lengthen a chin or to fill a temporal hollow, a peanut head. But they do serve a purpose. And one of the nice things about hyaluronic gels is if you hated them, said no guy to me ever so far, but if you did, you could make it go away with an enzyme. It's not inexpensive, but it's doable. So if you decided that you wanted to have the HapPenis procedure and you went to your spouse and your spouse said, get that thing away from me. It has now become a Christmas ornament. It's lovely to look at, but I don't want it coming near my space. You could reverse it. Or you could wait 9 to 12 months. And guess what? All that hyaluronic gel will be metabolized by your body and you'll go back to whatever state you would have been if you'd never had that. So the nice thing about hyaluronic gel is it gives a lovely, very natural looking volumizing, engorgement, if you will. It turns a grower into a shower who has more girth all the time. And it's resting in the potential space between the skin and the hydraulics. Now, there's a lot of little filmy layers of tissue in there. So it's very critical that you get the material into the right potential space. With hyaluronic gels, you generally don't have to worry about formation of lumps or bumps or fibrosis or things like that. Sometimes you can have a little bit of asymmetry, and we have ways around that we've pioneered over the years to help improve that. And it generally stays in place very nicely. Now, some guys are concerned and they go, well, if you're putting it from the base of the penis up to the circumcision scar or where the foreskin is, what about the tip? In having seen now thousands of penises over the past 20 years, there's all kinds of ratios of tip size to shaft size, and they all work. We've seen fairly small tips. We've seen significantly large umbrella or mushroom toadstool tips. They all seem to work fine. We want to be careful about putting volume into that tip, though, because it is a vascular space. We don't want to have a vascular occlusion from an elective procedure. We don't want to take the risk of decreasing sensation. And the tip of the penis, while it does engorge, doesn't get as big. It just becomes more firm to allow for penetration. So when we do that, we're very careful. We actually have ultrasound that we can look, while we're doing injections and actually see on our screen exactly where the needle is, avoid vascular spaces, inject only on the retrograde, stuff like that. But we're not going to give away all of our special techniques. The key to it is probably not the best idea unless you really, 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 really want it or need it. So let's stick to the shaft area. The next category of fillers that we have available is a little less flexible. And it's a calcium-based filler. And this is a bioactivator, a biostimulant. This filler has a carrier gel, methylcellulose in this case, and a filler component, which is actually microspheres, about 18 million microspheres per syringe of calcium hydroxylapatite, or Radiesse. Again, been around in the market for years and years and years. FDA approved for the effacement of the smile lines and along the jaw line. We use it all over the body, even the backs of hands, so that the tendons and blood vessels don't show as much. And nice because it lasts a little longer. It probably lasts in the 9 to 15 month range down below, but it is thicker and it has more of a milky consistency. So one of the things we see in people who are very, very, very light skinned, when you put a water-based hyaluronic gel under the skin and the light refracts off of it, it can have a bluish look. And while we've not had that complaint below the belt, certainly above the belt, if you're standing in the grocery store line and you have someone who's very thin and light-skinned and the light hits it the right way, they look kind of like a Smurf. Nobody wants to be a Smurf below the belt. So, but generally not a problem, and certainly not a problem with Radiesse or calcium hydroxylapatite. And this material is firmer. It isn't immediately dissolvable. If you wanted to dissolve it, you're going to be stuck with it for 9 to 15 months until it goes away. And because it is a microsphere-based filler, if you have a lot of accordioning of the penis or manipulation during the setup period that we'll talk about over the first 3 weeks, some of those spheres can kind of glom together and you could have a nodule. Generally not one that your partner would feel, but you can feel both sides, so you would know it's there. Or you can have some asymmetry. So we would rather put this material in guys who are longer. Length usually is associated with thinner, because the longer you stretch something, and for you guys out there that are joking and putting things on stretch and stuff, recognize It's not a long lasting effect. It temporarily increases the length of the penis, and that's why we don't talk about that when we're putting in fillers. But when you pull long, it tends to thin down. So, but for the guy, the 7-foot-tall basketball player that has was gifted, from their parents with a very long penis, we can fill them out. And this thicker material is probably a great one to use. It tends to be a little more economical per unit cc or milliliter. And it's a way to sort of dip your toe in and make sure that you like girth before you commit to potentially the third category, which is a long-lasting category. So long-lasting is also a bioactivator or biostimulator. There's only one approved in the United States for the effacement of the nasolabial folds, so smile lines. It's also approved for treating acne scars. It has a 5-year indication in that in the face, about 80% of the contour correction was maintained at 5 years, and in the 10-year studies, over 70%. So that bodes well. While this head and that head are not exactly synonymous in terms of how they hold on to fillers and how fillers are placed, they are similar. So long-lasting fillers, and that's what many guys are working towards, are very beneficial down below. We find more than half the guys that come in, I think,
more than half.
I would
say
a long-lasting filler.
90% go straight to the long-lasting filler.
Yeah. And they're often, more than half are happy with the results with just one visit. In this area below the belt, because it is moving so much and because it does compress and contract and accordion and do all those things that Godzilla or as we say with our mascot, Peter Richard Johnson, does, we need to be aware of how the materials are placed and place them in a way that they don't have as much high risk for nodular or fibrosis formation and things like that. So when they call in and they talk to Stacy and she goes through each of these things, and she'll talk about that and say, well, but the long-lasting ones are a little bit different because the carrier gel for the long-lasting filler is super pure collagen. Happens to be cow collagen. So if you can have a hamburger or a steak without breaking out in a rash, you can probably have Bellafill. And when you put that into use as a girthing agent, your body metabolizes that collagen very quickly. Maybe not from here to the parking lot, but certainly in the first 2 to 4 weeks. So while we get a nice girth, and we've worked hard to find the right number for most guys, but some guys will get a little bit more volume because they can afford the space for it. But the volume that you see on the table goes down temporarily at about a month with the long-lasting filler because the carrier gel goes away. And then over the next 5 or 6 months, maybe even up to a year, but certainly 6 months, your body is wrapping each of the 6 million microspheres per syringe with your own collagen and elastin. And that's what you get to keep for years and years. And it's not just 5 years, we're done. These cheeks have been around with Bellafill for the past 8 years. I was on TV being interviewed, much like today, and I saw the B-roll, except my cheeks had gotten super flat, and I didn't recognize myself, and I went back to the office and I fixed it. So I put far more volume in a penis than I put in both these cheeks together, and even a big face needs some volume to have its jovial look, and it works. It maintains. It's soft. There's no lumps or bumps or anything like that, and it works. It works above and below the belt. We'll leave it there. So we have 3 categories. We have a hyaluronic gel that is a lovely, very natural look. We have a slightly firmer look with our calcium hydroxylapatites, and we have a firmer but not quite as firm but longer lasting look with our polymethyl methacrylate or Bellafill category.
And also the Bellafill can't be dissolved either.
True, can't dissolve it, and once it's in, it's in. So if you're going to be using long-lasting, it's critical to go to someone who's done a lot, or at least enough of these, in the right surgical planes to be able to avoid issues.
Let's talk about that, because that is probably the most important thing, is that you not go to a provider that's not very well versed in injecting penises. It's not like injecting faces.
They're not forgiving.
No, it's very different. And so we've unfortunately, over the last couple of years where this has become more popular, have gotten phone calls from many, many men who have been injected by an injector who thought, oh, I can inject the chin, I can inject a penis. And it was a disaster, and it continues to be a disaster. So it really needs to be done by someone who knows the anatomy, understands the filler, understands how to
avoid issues.
Avoid any kind of adverse events. And so it's not to be done by someone who just injects. So this is something that we're trying to work on, educating other, injectors on, and, protecting that intellectual property so that we can teach it so that they can do it and do it right.
Yeah, I think that's a good point that Stacy makes, is that there are plenty of people who have not been under the skin, have not gone through surgery and gross anatomy where they've done the dissections and things. And they may be fine for injecting cheeks and some of the more flexible areas that are not as demanding. But when you're working right under the eyes or certain areas of the lip, or particularly the nose, not everybody injects or should inject noses. Those are more advanced injection techniques, and they demand a little bit more knowledge and experience and supervision while learning. And the penis is just that. It can be a very humbling experience, and we've certainly seen folks come in, particularly from out of the country, where we've had to send them to reconstructive urologists for the problems that they've had, the tissue breakdowns or the migrations of filler and things like that are beyond what we could just hide by adding a little supplementary filler around an area. And a word of a pleading: please don't use liquid silicone as an injectable in the shaft of the penis. In Nevada, of course, it's illegal to use an injectable silicone except to stabilize a bleed in the back of the eye. So it's by statute against the law here, but other places they're still injecting it. It can migrate, it can move around years after the fact. It may be have something to do with long-lasting connective tissue issues or immune issues or things like that. Please don't put it below the belt.
I understand there is a few states in the U.S. that do allow it, and we have had quite a few calls from gentlemen that have had it injected, and it's not been a good thing for them. So,
yep, that's another trip to your reconstructive urologist.
Yeah. So please
because
be
it has
careful.
to be surgically removed if it can be removed, and then rebuild the areas. And if it got into the hydraulics, it can really mess things up and cause occlusion. So be careful with that one.
Yeah, absolutely.
So what's it like the day of the procedure? They've had their conversation with you. You've answered a lot of their questions. You've set them up with a consultation with me, either video or in person, over our HIPAA-compliant video system for those of you guys in the rest of the United States and the world. And they've come to or flown or live in Vegas, and you've gone through the consents and all that, and they come to the office. We've asked them to manscape a little bit. They come to the office, and what happens?
Yeah, so then we just bring them back, and we give them a little bit of numbing cream that we have them put on, and then we have you come in.
So super strong numbing cream, guys, for those of you who are, this stuff is so strong. It allows me to make a little injection of numbing medicine like the dentist uses. Once we do that, Godzilla is in his sleepy time for a couple of hours, and he doesn't care what we do. And so we have a proprietary way of placing the filler. Obviously, we get before and after pictures all along the way and measurements and stuff like that. And placing the filler and making sure that it's spread evenly both at rest and when he's erect. And you will, even when he's numb, not during the procedure, of course, but you will have erections and be able to urinate and all that stuff. So eat normally that day. Drink, hopefully not a lot of alcohol or anything else that would be a blood thinner, but stay well hydrated, and we'll get you through the procedure. And after the procedure, we like you to stay in town for a couple of days to come back for rechecks and to make sure that everything stays well placed. We'll have you stay out of the gym for about a week. So no heavy lifting or things that would cause oozing or bruising, because there's not a lot of pain with the procedure. It's a little, fullness, sense of discomfort, pressure, whatever.
When I'm talking to gentlemen on the phone, of course, their biggest question is it painful? Is it going to hurt? They think it's a surgery. And I'm just like, nope, it's a very simple procedure. in a regular room in the office. And I said, I promise you, when you leave, you're going to be like, wow, that was nothing. I was so scared for no reason. Yeah. I think they're all very, very pleasantly surprised. In fact, a lot of them will just watch as you're doing it. And, we'll chit chat with them about what they're doing in Vegas. And it's very comfortable. There's no, crying or, wanting. We've never had anybody cry or jump out of the chair and run for the hills. I mean, it's a very easy
controlled
procedure.
Yeah.
I honestly, I think women go through more having their lips injected than men go through having their penis injected, honestly.
Yeah. Yeah. It's probably because we can do a better block. So it's sort of akin to a liquid facelift with fillers, but it's a different head. Yeah. The male equivalent of a BBL. And yet none of the downtime, none of the lipo, any of that kind of stuff. So kind of fun. Results, you see immediate. There's immediate gratification. Mm-hmm. As we talked about with the long-lasting filler, it does go down for, the first couple of weeks, but not all the way down to baseline. And then it comes back and stays up for years. So that's something that's kind of cool. And after 6 months, if you want, you can add some more volume. But, more than half the guys we do, especially with the long lasting, have been happy at 6 months. And we may not ever see them again, or we see them at 6 months, 6 years, whatever, to add some more, because as we age, we all lose volume in the places we don't want to lose volume. So our face, the backs of our hands, down below.
We do get that. That is another question that they do ask is, how soon can I get more if I do decide I do want more? And like you said, we usually have them wait about 3 to 6 months, depending on what the filler is. And then I always tell them it really is up to you to decide how much more you feel is safe and is going to look appropriate for what they're trying to do. But that absolutely can, we can do what they're happy with. We have decided over the years that there's a minimum amount, which is what we call the HapPenis Procedure. So we do have a minimum. We won't do any less than that because they're not going to see enough result.
We really want them to have that wow factor.
Right. And in most cases, that's a really good amount to start with. But yeah, they can always add more, and they can continue to add more as they like. We've got a couple of guys that have a lot of syringes in their significant
enhancement.
Yeah, and they're thrilled with it. And but like you said, I feel like there's a majority of the guys are really happy with that HapPenis Procedure, that first amount, and they're really thrilled with that, and that's been good for them. So
yeah, we spend a lot of time talking to guys and trying to understand what their goals are, so that we can get them there with the least amount of risk and the most economy. And the goal is to have you reach down in the morning, go, it's going to be a good day. I hit the genetic jackpot, and I had a relaxing weekend, and it shows. And that's why we call it the HapPenis Procedure.
That's right.
Yeah.
That's right.
Anyway, I think that talks a little bit about what the procedure is, about girth, about how it evolved over the years, where it's at, who should do these kinds of procedures, what the follow-up is like. And remember, there's a period of time after the procedure where no touch, things are setting up. We don't want to have the filler migrate and, get asymmetric or have it pulled to the tip or pushed to the base. Nobody wants to wake up with a donut with a popsicle stick sticking up kind of thing, because if you move it around, it's a lot harder to push back. So, to go follow the directions that we have, and uniformly, we've had, pretty happy patients. And then if you want more down the road, you can have more. Just don't put in so much that it becomes a Christmas ornament.
Unless that's what you want.
Unless that's what you want. And we have a few guys who get stopped through TSA every time they go through because they don't believe what they see on the screens. But that's a whole different thing. The goal is to create happiness both for you and your partner or partners. Remember that when you do this procedure, it does not protect you from STDs or STIs. So take precautions. Don't catch anything I can't treat. It's not going to change your testosterone level. It has no incidence of increasing prostate or testicular cancer or anything like that. It's purely an aesthetic procedure. Now,
it also doesn't affect the sperm count.
Right.
So you can still have.
So you're still potent
children.
if you're still potent. But it does. So some guys ask, well, can I have botulinum toxin injected into the corpora at the same time, or PRP injected? The answer is yes. We package all those things together to make the best use of your time and numbness. And visit to Las Vegas, or unless you're a local. And yeah, we can package pretty much all those things together. So that creates even more happiness.
And if you're wanting happiness, we can have you call the office and schedule a consultation with Dr. Zimmerman.
Yep.
Or just ask some questions from myself or one of our other staff.
Yep. Yeah, we've done hundreds and hundreds of these. So staff is a great place to start with your questions. And I think that one of the nice things about being a resource is that we're not shy about talking about this. This is kind of a taboo topic for reasons that, I don't understand. I'm just a doctor. And, we treat this as part of life, as part of medicine. So we try to present in an unbiased fashion the realities and what our experience has been. And
please don't be embarrassed to call and ask all the questions that you want. That's what we're here to do. And you're right. These are the same kinds of questions every day, all day long. We hear these questions. So it's nothing to be embarrassed about. And, we're happy to talk about anything that you want to talk about. It's not a problem.
Well, within reason.
Yes, within reason. But yeah, I mean, I would just hope that people don't feel embarrassed to call and get their questions answered.
So you're saying you get non-biased education with just a few dad jokes thrown in.
Right. Exactly.
Okay. All right.
We're not as good at dad jokes as you are, but
we have fun and we try to be educational.
To have the consultation with you. You'll get more dad jokes.
Thank you.
Yeah.
All right. So anyway, thanks for tuning in for another episode of Aesthetic Revolution, the podcast. This is our introductory education on happiness or girth enhancement. And listen, look, share, subscribe, ask questions. We love to answer your questions, and call us, get in with Stacy to get your basic questions answered, get in with me to have your personal questions answered, and we'll see you next time. This is Dr. Ed Zimmerman, aka the Dick Doc, and Stacy Taylor Zimmerman, signing off for now and saying thanks for listening.